I've been introduced, but my name's Christine Orr. I'm the mother of 2 boys, ages 11 and 7. My youngest, John, is here in the front row. John, can you stand up? Turn around. Wave. He's our bleeder. Jimmy, 11. You can stand up. Wave. Is not a bleeder. So we have one hemophiliac and one who's not. Before John was diagnosed, I was unaware that I was a carrier for this genetic abnormality because I already had one kid who didn't have it, didn't expect it. With no knowledge of the disease or the risk of my offspring being affected, the diagnosis was crippling. The first thing you think when they tell you he has hemophilia is, what is that? And how on earth am I going to handle this? I know we've talked a little about it, but for those of you who don't know, hemophilia is a genetic disease caused by the deficiency of clotting factor 8. It's the most common type of hemophilia and occurs much more frequently in males. Incidence is estimated at 1 in 4 to 5,000 male births. People born with hemophilia have little or no clotting factors. People with severe hemophilia have little or no clotting factor 8. These proteins work with platelets in the clotting process, and when blood vessels are injured, clotting factors help platelets stick together to plug cuts and breaks on the vessels and stop bleeding. Many patients with hemophilia experience spontaneous bleeding events, and those result in progressive and debilitating joint damage, which we have. The hemophilia community is made up of incredibly resilient people. Most of us are completely unaware that the genetic mutation exists in our family, and others who do know hold their breath, praying that the genetic roulette spares their son the diagnosis. We had absolutely no idea that I would be a carrier. We had our baby in the fancy little hospital. It gives you the adorable bathrobes and champagne after delivery. NICU, we don't need that. We were wrong. You see, hemophilia is really rare. It might be a few questions on the MCAT for some physicians. They read about it, they get it right, but they never really see it in practice. And it's not just because it's uncommon. It's also because most of the patients died in the 80s and 90s due to HIV-tainted blood product. Our pediatrician had never seen it, and the signs were all there. Hemophilia was glaring at us in the face. Umbilical cord, dripping blood. Heel sticks, dripping blood. The circumcision, lots and lots and lots of blood. By the time we got to the NICU at another hospital, where we should have had the baby, we were terrified. We were shaky, we were weepy, we were broken. We were staring at our baby in an incubator, bleeding from so many places. But I'll tell you something, the staff at Lucille Packard, Stanford, they know hemophilia because that's where they first found the original cure or treatment. And as soon as they began treatment, he began to heal. It was like a Terminator movie. He just started clotting. I've never in my life been so thrilled to see scabs. But with that success came a really big reality. This is forever. And I've spent the past 7 years giving my son infusions every other day, either intravenously or through a port in his chest. And this prevents his spontaneous internal bleeding and allows him a very normal lifestyle. It has some exceptions. And every day I'm either setting up or distributing an infusion. And every day I am challenged to smile and accept our very abnormal normal. The diagnosis crushed me. I felt like a victim to it. I personally spiraled into some pretty severe depression. What I learned along this hemophilia path is that I have to feel really sorry for myself and weep on the floor of the shower, which we've all done, in order to rise from those ashes. And the glory of being the phoenix and rising from the ashes is that you can not only lead yourself towards success, you bring your followers as well. My followers are my husband and my 2 boys who are here in the audience. The disease that ripped my heart out initially gave me the opportunity to be a much better person. It made me stop being a follower. It made me lead my family into change, and we accept our very abnormal normal and find rainbows and laughter with every challenge. You see, when you become a parent, you spend late nights reading books about how to swallow your baby and, should we breastfeed? Should we use formula? Cloth, disposable diapers, which one should we use? You don't, however, anticipate if you should get the 25 gauge peripheral needle or maybe the 21 gauge today. You do not anticipate tourniquets for toddlers or having to get nurses to steal needles for you from the clinic because your insurance refuses to pay the extra 32 cents to keep your child's needle safe. You don't anticipate sleepless, fearful nights in the emergency room, unsure if he has a good old-fashioned flu fever or his port could be septic and poisoning his body. You see, treating my son John has taken the most courage. At 9 months old, John started repeatedly spontaneously bleeding into his joints, which left significant damage. We had a portacat sewn surgically into his chest wall, and that allowed us to treat him every other day. No mom is supposed to stand over her baby strapped to a papoose board and stare while he stares at you unaware of your fear and place a needle into his chest. You're just not equipped to do that. But we do it, and we cope with our challenges, and we move forward. The thing about this diagnosis is you're not allowed to wilt. You gotta get up every day and put on your big girl panties, dust your knees off, and tackle every fear. When the port fails and you have to learn peripheral sticks on your 4-year-old, you get creative. You ask the firemen across the street if you can practice on them until you can do it without sweating bullets and blowing through the back of your kid's veins. So when you need to treat that terrified 4-year-old, you do it with grace. You see, there's no chapters in the parenting books on how to soothe your child when he asks when he will be normal like the other kids, or when his hemophilia will go away. We always cope with those challenges and we move forward. As a mother, I carry guilt. Guilt that I've given him this broken genome that stunts his activity and eclipses the joy of just being a boy, of life and exploration. I feel guilt that I'm why he cannot climb trees or play football, or even wrestle his brother really hard. Instead of coping with these challenges, I've learned to embrace hope. And for years I coped. I coped with trauma, the drama, and the dynamic changes with John's diagnosis. But finally, I do not just have to cope. I have true hope. And with the research at Biomarin, there's true hope that in my son's lifetime, he will have a cure. I have hope that I can offer him a life like any other person without cautiously living on the periphery. No is a word you hear a lot when you have hemophilia. No monkey bars, no football, no, no, no. And as the parent of a bleeder, you challenge the status quo a lot. I dread the beginning of every school year. Fall breaks my heart. I can handle the medical and treatment side of this disease. I'm a really good nurse. But the emotional toll is the really hard part. You see, parents are afraid. They're afraid to invite your kid to play at their house or invite him to a birthday party. They're afraid. In kindergarten, John's teacher noticed he was being excluded after school, not invited to parties. She pulled each family aside, unbeknownst to me, at parent-teacher conferences and asked what they think of that new student, John Orr. Magical John Orr. None could reply. And she told each one of them they should be ashamed for their bias that they are missing out on this magical kid. And it's really rare to have an advocate. Advocates are not just friends or teachers. If you look up advocate in the dictionary, it says a person who argues for or supports a cause or policy. A person who works for a cause or group. Biomarin is composed of my advocates. The scientists and employees at Biomarin are finding cures for rare diseases that everyone else has overlooked. And they're not just looking for a new treatment or a new product to use every day. We've got a lot of those. Biomarin is going to create the cure. They are my advocate, they are John's advocate, and the entire hemophilia community's advocate. Biomarin is creating innovative treatments for patients like my son who have unmet medical needs. Biomarin is developing a gene therapy that has the promise of delivering the missing gene to produce the one missing protein we need, factor 8, in one dose. And it may potentially eliminate the need for prophylaxis and on-demand treatment for my son and my entire hemophilia community. And this facility right here represents more than a potential cure for my son. It's also going to bring our family a ton of peace. After almost a decade of hearing no, yes is on our horizon. And the opening of the Biomarin facility has given me a whole new outlook. I think, yes, I can do this. I can do this just a little longer. 10 more years of infusions, 1 more year of infusions, whatever it is. There's an end point. There's cure ahead. This facility and its remarkable product are going to give my son and our community independence. And as a parent, this building is more than just a facility. It's going to allow my child to choose his path and not let hemophilia choose it for him. And his opportunities and life choices will be made with his head and his heart and not his diagnosis. We are so grateful for the innovation behind the doors of Biomarin.